Assalamu alaikum viewers, how are you? Hope everybody is fine and good. Today my topic is how to take care of your teeth and what if you will not brush and take care of your gums and teeth, what will happen. As I am an oral hygienist, I will let you know some tips and general introduction of plaque and pellicle and some diseases, and I will try to cover also in this video regarding brushing and type of toothpaste and some tips. So let's start. Initially, what happens if we eat or if we did not brush our teeth? There is a plaque. Before plaque, there is a pellicle. Pellicle basically it's developed automatically on the tooth surface. Either you brush within after 30 minutes of your brushing, the pellicle will automatically be created on your tooth, as you can see in this picture. It will automatically be created on your teeth, so we don't need to worry about the pellicle, but we have to worry about the plaque. If there is a plaque, it can cause, if it sticks on the tooth surface and you did not brush your teeth, it can cause some kind of inflammation which leads to gingivitis. In the beginning, the plaque will stick on the tooth surface and it will make with your saliva and with other acids in your mouth, it will try to mineralize this plaque on your tooth surface, so it will convert it into calculus, and it will there is a kinds of calculus also, supragingival and subgingival. I will discuss this one later, but basically my task is to give awareness regarding plaque. What is plaque? Plaque is basically sticky substances that sticks on your tooth surface. It's like the food debris or something, that accumulation of food, something if you eat and there is something remaining on in between your tooth surface and it sticks yellowish like that, a kind of a biofilm that have a lot of bacteria inside, that it will sticks to your teeth and it will affect your oral health. So basically we need to brush our teeth. For that, I will tell you the tips later on. So what if you will not, if you will let it grow? So what plaque can do? Plaque basically it will affect your oral health. First, in the beginning, as you can see in the picture, what is plaque? You can see this plaque. If it sticks to your teeth surface, it will affect your gums and your gum will become red. There is a redness, there is a swelling, maybe there is a heat, and then it will give pain also, will bleed your gums. So we need to remove plaque by brushing, by flossing, by gargling. There are different methods we need to use for that. And as you can see, some pictures I show here. It will lead to periodontitis. It will finally, eventually, your tooth will be extracted and you will lose your natural teeth. So now, how to clean your teeth? By brushing, by flossing, by gargling, by brushing. If you're using a good proper technique, it will help to reduce and to finish the plaque. And then if you have to make sure, if your brush, there is a three kind of brush in general. It's hard, medium and soft, but I will suggest to buy a medium or either soft brush, because if you don't know how to brush your teeth properly and you are using a fork, for example, let me show, For example, this is study model. If you are using a wrong brushing technique, back and forth like this, it will do what? It will give abrasion on your tooth, as you can see in the picture. Abrasion, it will create cavities back and forth. And if you're doing this back and forth technique, wrong technique, it will also reduce your interdental area of your gum. So you will might be have gingival recession in your teeth, some kind of complications, like there is a sensitivity, there is some kind of pain, so it will affect your teeth. So you have to do proper brushing technique, guys. And in your major meal, for example breakfast, lunch and dinner, after you eat your meal, breakfast for example, after 20 minutes of your meal you can brush your teeth. So guys, why we need to wait for 20 minutes after we eat for brushing? So the thing is, if you will not wait and you brush your teeth, there is some acidic reaction in your digestion, and there is some secretion in your mouth that can affect. So better to wait for 20 minutes of brush. It should be brushing should be 2 to 4 minutes at least, because if you will brush very hard or very fast, within 1 minute you just wipe and brush your teeth and you spit it out and you gargles your mouth, there is no benefit of that. It's like toothpaste. There is a different kind of toothpaste which have components we need to know: stainless fluoride, sodium monofluorophosphate, sodium nitrate. Different toothpaste have a different functions. So basically, our main goal is we need to find a toothpaste. It's available mostly in markets with the name of Colgate, Crystal, Oral-B, and Crest. Other kind of toothpaste. The toothpaste have fluoride, because the fluoride is the basic component that can help your tooth surface, that can protect your tooth, will help to make strong your bone of the teeth, and it will protect against caries. So we need to find a toothpaste which have fluoride, and it's different in different toothpaste, the fluoride quantity in the toothpaste. So in my next video I will explain it in detail, the type of toothpaste and the type of brush, inshallah. The tips: in your major meals you have to brush your teeth after 20 minutes of your meal. Secondly, you have to brush your teeth gently, and the duration of brush will be 2 to 4 minutes at least. And the third thing is flossing. You have to do flossing every day, once a day at least. If you floss your teeth, it's good for your teeth, because there is a interdental area. If the interdental area is not cleaned, as you can see this area, if this is not cleaned by the floss, your oral health will affect it. Your teeth, your gum will affect it. There will be a pockets. If, for example, if you eat meat, any kind of meat, chicken and beef, fish, whatever you eat, it will stuck in your molar, or either in canines or either incisors, wherever it stuck, and you just brush your teeth and you did not wipe and clean this area, you did not clear this area, and there is a natural space, as you can see, even in your own teeth you could see. If this natural space is not remains, you will have pocketing. Your teeth will have a dental pocket first. There is a swelling, there is a bleeding maybe, and then you will feel pain, and there is a cavity, and it will leads to a lot of problems. So better if you're using floss once a day, it's good. or either if you cannot make your habit to make flossing every day, you could do it by another day, one day off, one day, like that. And the special thing is that you have to floss your teeth, especially if you eat meat. You have to make flossing, because if your teeth have food debris or meat particles between the teeth, and it's not removed, it can cause a severe problem. So brush your teeth after every meal, after 20 minutes of your meal, and try to floss your teeth every day, because mostly I see a lot of people, they did not floss their teeth either once a day or either once a week. So this is not a good thing. You have to make notice on this one. And then you need to know about the brush type. It should be either soft or either medium. There is a lot of brush available in markets. Even now there is a electrical brush also, but basically I will just let you know some brush. Like, there is a basically three types: medium, soft, and hard. So I will suggest and prefer to buy a brush which have soft bristles or either medium bristles. This is I use myself soft brush, soft bristles, or either medium, because if you have a hard brush and you are doing a wrong technique on your brush, like this back and forth motion, the first thing it will cause abrasion on your teeth surface. Like this, if you are brushing, if you are making brush like this back and forth motion, as you can see in the picture, you need to go to the doctor for making restoration of your teeth. And then the second side effect of wrong brushing technique, if you are using your gums in interdental area, it will recede, gums recession, as you can see in the picture. You need to do the brush very gently in and with the proper techniques, so it will help to maintain your oral hygiene. And try to eat balanced diet. Limit your sugar if you're eating sticky food or sugar. Mostly if you're eating some kind of sticky food, it will sticks on the occlusal surface of your teeth, as I can show in this area, especially in the upper area and either the lower area of your molars. The sugar will stick in this area and can cause caries if you will not brush your teeth, or either you did not wipe this area with proper brushing technique. You will have caries, and you need to go to dentist for restoration and filling. So better to limit your sugar, sticky food. Try to eat the balanced diet. Use vegetables, salad, fruits, dairy products, and try to close to the nature. The diets which have junk food, oily and spicy foods, try to avoid that one. And either the drinks, like cold drinks, if you are drinking cold drinks, it will also affect your teeth. So it will gives you erosion, which is not good. Acidic reactions that that affects your bone, teeth bone. And then the last and most important thing, whenever you brush your teeth, try to wipe your tongue with the brush. And there is some special tongue cleaner, you could buy it from market. I will show some tongue cleaner. You need to tongue your clean after you brush your teeth, because either you brush your teeth, there is some bacteria remains with some secretions, with salivary secretions, with some acid secretions on your tongue. Yeah, if it is still there, it can cause bad breath and other problems. So better To wipe your tongue, this is the most important. Brush your teeth, floss your teeth once a day, and at the end of every brush, you have to wipe your tongue either with brush. It's good, so you feel a fresh breath. You will not even you are talking, you will not give a bad breath effect. So this is all you need to know, and I will try to discuss my other topic in another video regarding bad breath, toothpaste, type of toothpaste, brush, type of brush, and which toothpaste is used for cavity protection, which toothpaste is used for bleeding, which toothpaste is used for sensitivity of the tooth. So I will discuss in my next video, and I will give some tips. Thank you so much for watching.